And then we also found what we call a post hoc group. This was one we didn't anticipate, but they really jumped out. And these were boys with mild intermittent asthma severity at baseline. So not all the children in our received the cladosporium skin test panels. We added it about a year into the study. And 84% of the children who were allergic to cladosporium were also allergic to Alternaria. 36% were allergic to both, or either. And so we decided to group those two together. So we found what we call statistically significant associations for at least two of these three subgroups for more pollutants. In addition to NO2 and the forced fraction, we also found associations for nitrate, elemental carbon, and PM2.5. And in most cases, the effects were greater in magnitude for all three subgroups. But not in the full group and not in any of these subgroups did we find anything about ozone and leaks. So this slide here is going to show you, if I had a pointer, I would use it. But it's going to show you, if you look at the black diamonds in the middle, that's what we call a point estimate. That's sort of a main effect. And then that line, that black vertical line is showing you what's called a confidence interval. And so what you see when you look at the pattern of the black diamonds is when you look at, the black diamonds are in order, NO2, forced fraction, nitrate, elemental carbon, and PM2.5, you'll see that the black diamonds rise when you look at all of the subgroups. And then you see that the black diamonds sort of rise the most when you get to that group of boys with mild intermittent asthma. And they rise about equally when you're looking at children who are allergic to cat dander or children who are allergic to those two fungi. So as far as our forced fraction findings go, only a few studies have shown that this pollutant is related to asthma, and this is the first study that we know of that found an association of the forced fraction with wheeze. And for our NO2 findings, they may be proxy-traffic, or they may directly affect the child. More and more now, people are thinking that NO2 has a direct effect on asthmatic children. It used to be that they thought it was just a proxy for traffic. Traffic was also associated with changes in lung function in another study that was done in this cohort. And NO2 as a marker of traffic was associated with both prevalent and incident asthma in the Children's Health Study. And it's been shown to enhance bronchoconstriction responses to inhaled allergen in sensitized adults. Other groups have shown that Alternaria and or cladosporium concentration is associated with asthma exacerbation, but remember in our study it was skin test positivity to either of these. And also note Alternaria and cladosporium are found in the first fraction. As far as boys with mild intermittent asthma, a few studies have seen greater effects among mild asthmatics, and some have seen greater effects in boys, but the results on this are mixed. So now I'm going to jump to a study that looked at PAH in wheeze in our cohort. I was not the first author on this study, nor was I the second author. Sarah Gale is about to get married, and Elizabeth just had a baby. So when we get to questions about PAH, I may defer them to Kathy, but here we go. So the aim of this study was to look at the relationship of short-term ambient air pollution in PAHs on asthma morbidity, in this case wheeze, in our population. And then also here in this project, we were able to look at what happened when we used these central site exposures and versus when we were able to look at individual exposure estimates. So our outcome again was wheeze from the spirometer. This particular project used more air pollution data. It went out to 2007, so it had over 19,000 observations. And looked at a few different ways of looking at pH. The first was the sum of PAH with rings 4, 5, or 6. This was done at both the central site and as individual exposure estimates. And then we also looked specifically at phenanthrene, which was which all came from our individual exposure estimates from the land use regression. And we were, the way that, well, actually, I won't talk about that, but this is an example of something that Kathy talked about in her presentation. This is one day, and these are different PAH exposure distributions as estimated with land use regression in Fresno among our study children. And the width of the sort of the diameter of the circles has to do with the concentration of PAHs. This is a winter slide when PAH concentrations get higher. And it's just to show you a snapshot that these individual level exposure estimates really do capture a lot of the spatial variability in PAH that we can't capture when we just use the central site. So this slide is it's a lot of numbers, but I'll take you through it. So I've highlighted two of the columns on this slide. The first is, two of the rows. The first is looking at PAH concentrations 2 days ago, although pretty similar findings were found when you looked at same-day concentrations or things that were 5 days ago. And what I'm going to show you is that the first column shows us what happens when we use the exposures from the central site. So we did see an elevation in wheeze when we used this as our measure of exposure, very equivalent to what I showed in the earlier talk, about 10%. But when we use these individual exposure estimates, that goes up. And so these first two columns should be pretty comparable in what they're measuring. And you see that the point estimate goes up to 1.17. Now this isn't statistically significant, which means the confidence interval crosses 1. But it is pretty near significant, and so that's really interesting. And then the final column shows what happens when we looked at phenanthrene, and you can see a much higher point estimate for phenanthrene specifically. So this showed that there was a consistent positive trend across all three types of estimates. For every 10 nanogram per meter cubed increase in PAH, there was an increased odds for wheeze. Phenanthrene had the highest, was very common component of PAHs in our ambient air pollution measures, second only to naphthalene. And for that, we found stronger associations with wheeze. And then also the odds of wheeze was greater when we used these individual level exposure estimates than when we looked at what was happening at the central site. And this is the first study to look at these associations, so it needs to be replicated in future studies in other populations and locations, but were very interesting results. I want to credit the work of the very large FACES team, which includes our two co-PIs, Ira Tager and Kathy Hammond, also John Baums, who is here today, and Fred, who is here today, and then also our field staff, two of whom are here today, Liam Melendez and Cindy Heller here today. And without our field staff, this never would have happened because we asked our families to do so much for us, and they continue to come and participate. So thank you very much.